Throughout Black History Month, WFMY News 2 is highlighting the work and impact of Black leaders in the Triad. I spoke with one Novant Health top officer who continues to break down barriers by promoting equal access to quality care.
Dr. Chere Gregory dedicated her career to being a voice for the voiceless. She's the Senior Vice President and Chief Health Equity Officer for Novant Health.
Essentially what that means is our goal is to ensure that regardless of your dimensions of diversity, you are able to achieve the highest level of health, race, ethnicity, sexual orientation, gender identity, where you grow up, your zip codes.
As a change agent and originator, Dr. Gregory is the first of many. The first African-American woman in the U.S. to design and direct a neurocritical care unit, and creator of the first Joint Commission certified primary stroke center in the Carolinas.
One of the youngest patients I had was 19 years old. So I realized very early in my career when I moved to North Carolina that health equity was incredibly important, and the health disparities that communities experience lead to premature stroke and heart disease and other health challenges that are by and large preventable.
While at Novant Health, Dr. Gregory helped launch a regional neurology practice and neuroscience hospitalist team. She said understanding her Black history inspires her daily.
It really has helped me to start conversations around what is historically true about our country and why it might be that certain communities, particularly Black and Brown communities, have potential mistrust for some of the care that may be provided.
As a wife and mother of 4, Dr. Gregory hopes to be an example for the next generation, that anything is achievable no matter their background.
My mom and my grandmother were great supporters, and so we would have these conversations and they would say, they don't define what your future is. You define what your future is. So once you see something that you love, don't let anything stop you. Go for it.
Love that quote. When we were doing the interview, I said, my parents used to tell me the same thing, like your friends or other people don't define your future, you define who you want to be.
Lauren and I were talking during that piece. Some people just sound so smart and put together.
Yes.
That's her.
Yes.
I mean, like, if I'd believe anything she'd tell me, because she just sounds like she's got it all down.
Yeah.
I love when there are broken barriers, because then, I mean, think about all of the young kids who might be watching this story who are like, I can do that.
Yeah.
I can do that because there's someone who looks like me who did that first.
Absolutely. That's why it's so important for us to tell these stories so folks at home can see that and aspire to be those things. Another thing that stuck out to me about her interview, you know, during Black History Month, we talk about, you know, things that people are doing, but she talked about how knowing your history can give context to the field that you work in. With her trying to grant access to quality care for people of all backgrounds, knowing the history and the systems that are in place in our country allows her to be able to do that and have a different understanding.
It's true. She's a role model.
Absolutely.
You know, a huge role model.